Thank you. Well, hello everyone and welcome. This is Carol Scott, the Ombudsman Specialist for the National Ombudsman Resource Center. This webinar, NORS Consistency, is being recorded and therefore everyone's phone line is muted. If you wish to ask a question, and we hope that you will, please type the question in the box on the right side of your screen. We will address those questions following the presentations, and if time permits, we'll open up the phone lines for more conversation. We would well, there we go. And today is February the 9th, 2017. Today we're going to be looking at some definitions of cases, some what a complaint and a consultation is. We're going to hope that by the end of this that we will have discussed some of the challenges which states seem to face trying to understand the importance and value of the data and sharing that with your representatives, and how to get representatives of the office, both staff and volunteers, to report what they're doing and to ensure that there's consistency and quality in that data that's actually reported. We are going to start with some of the homework. You were asked to review the definitions of case, complaint, and consultation. And so if, Katie, if you will open the first poll. And so I can't see it, but are people able to vote? Katie?
Yes, people are voting.
Okay, so this is the, your state requires that all allegations of abuse be reported to Adult Protective Services or the police, and the Ombudsman program be notified. You receive a routine notification from APS, which is investigating the allegation. Is it a case, a consultation, both A and B, or none of the above? So you can close the poll and show us the results.
Can you see them?
I can't. Louise, can you guys see them?
Sure. So, yeah.
So could you tell me what they are saying?
So basically, 10% thought it was a case, 30% think it's a consultation. Nobody thought it was both a case and a consultation. 60% said none of the above.
Okay.
So,
well, congratulations. The answer is, drum roll, D, none of the above. This is neither a case nor a consultation. The Ombudsman program is not actively involved in investigating and working to resolve the complaint. And this not only illustrates that point, but opens a vital teaching point in those states where the Ombudsman program receives pro forma, in other words, just because people are sending them in, notification of abuse allegations, but isn't the lead organization for investigating the allegations. Louise, do you want to add anything to that?
Not at this point. I think we'll get a little more into a discussion. You know, I think maybe more in the context of long-term care ombudsman programs receiving transfer discharge notices, and that's kind of putting a big wrinkle into NORS. So it's a similar kind of example, but it's a real live experience that, and how states respond and all that impacts their NORS coding. So
okay,
I'll save it for later.
Thank you. So those of you who were thinking it was a case or a consultation, if you know, after you've heard today's presentation, if you want to discuss this further, please feel free to reach out to either Louise or to the Resource Center. This is, this is kind of one of these basic tenets of the NORS reporting, and it's so important that you guys understand it so that you can explain it to your local folks. Katie, if you'll open up poll number 2, please.
One thing I will say is, we're just looking at the face of the information you got is how the answer kind of plays out. We know there's can be more to a story, but just based on this information.
Good point. Good point. Because if you actually followed up and went to the home and met with the resident, then that's something completely different. So that's a great point. So this one is Mrs. Oliver asked you to help her obtain the medical records for her mother who recently died in a nursing home. She is the executor of her mother's will and was her health care durable power of attorney. She is planning to use the records in a private action lawsuit against the facility. These 2 questions come from the NORS training that are on the website, and I only picked out 2. There's a whole page of these that can be used in training with your local representatives, either staff or volunteers. So, Katie, close the poll, and Louise, if you'll tell us what the results were.
Okay, 17% think it's a case, 50% think it's a consultation, nobody thinks it's both, and 33% say none of the above.
Okay, well, the correct response is either A or B. This may be a case with 1 complaint, or it may not be a case. The discussion would surround for whom the complaint is made, working on cases involving residents who are deceased, and whether the situation could affect other residents who may want to have access to their records. If it's a case, the complainant is Mrs. Oliver, a relative, who is the executor. If not a case, it is a consultation where the Ombudsman provides information on the process to access resident records. So, in other words, if information is just provided on how she would go about getting those records, then it's a consultation. If you decided, or it was part of your policy in your state, that you would work on cases involving residents who are deceased, then you, and we're looking at it in terms of perhaps other people getting access to records, then it would be a case because you would have to do some investigation. Louise, any comments?
No, I think you summed that up well.
Okay, great. Thank you. And Katie, if you'll open up poll number 3. Great. And this is, can we count Ombudsman articles in the AAA newsletters or Senior Center newsletters as media? And this question came from the frequently asked questions and answers that each of you were asked to look at on the website that contained just a whole bunch of different miscellaneous questions regarding different parts of the NORS report. And if we're ready, so yes is you're using the AAA to get the information out, so it would count as media, or no, this activity is not work with media. If you'll close the poll. And Louise, what do we see?
Yeah, Well, this is kind of a close one. 44% say yes, that it is a media instance, and 56% say no, this is not an activity of working with the media. So very interesting.
That is very interesting. So the correct response is B, that this is not work with media. And when you look at the NORS instructions, and I realize that you guys may or may not have seen this one if you had time to look at the frequently asked questions, but there is a definition of what media is, and that is radio, television, newspaper, reporters, that kind of thing, as opposed to a newsletter that would be considered more sharing of information. So if you have questions about this, also feel free to reach out to Louise or the Resource Center. If you did not get a chance to look at the frequently asked questions, feel free to look at that. The link was sent in the email that said homework on it. Because, again, this is so important that you guys have it clear in your head where an activity that you're doing gets marked in NORS and whether or not it's even appropriate to mark it in NORS. I mean, there are some things that activities that ombudsmen do that don't get reported, at least at the federal level. There may be some things that you guys are doing that you collect at the state level, but it's also because it's important that you understand so that you can make sure that your representatives understand, because that's where the whole idea of the consistency comes in, so that when people look at not only the state numbers but at the federal numbers, that they know that a number they're looking at has the same definition and the same parameters. So at this point, thank you for participating in these polls. We're going to have a few more later on in this presentation, but at this point I'm going to make Louise Ryan, who is with the Administration for Community Living and the Ombudsman Specialist, she'll be our next speaker. So Louise, please take over.
All right. And I would say, I know, just to follow up on the last poll question, I know there's some frustration by state ombudsmen and local programs regarding, why don't these things count as media? And, we have, again, there is the definition in NORS, so we try to stick with that. The other thing is, at the federal level, we don't always need the level of detail that you need at the state level or the local level. And so it's not that it's not important or useful, but it's just something that in terms of what we are looking for, it's just not, we don't need that amount of detail. One thing I will mention is we are doing the evaluation of ombudsman programs through NORC, University of Chicago, and right now they're doing what's called a process evaluation. Later we hope to have another future contract to do an outcome evaluation, and some of those kinds of other things that you do are going to be really important for those evaluators to look at. So just to kind of put that out there, that we understand there's more work that you do that's important. It just doesn't always roll up into NORS. So with that, I will get started. Just going to give you all a quick reminder of what NORS is, a few tips to achieve consistency, and some resources, and why we use NORS, and that, why the consistency matters. And then we'll have time for question and answer towards the end. So as you know, NORS, National Ombudsman Reporting System, is the collection of data elements that you are required to collect per the Older Americans Act and the Long-Term Care Ombudsman Program rule. And the purpose of it is to get an understanding of the experiences of residents, the types of complaints they experience, the resolution, the outcomes, the other activities that the program does, like consultations, visits, and then also to get a sense from State Ombudsman of the systems issues. So here I've just got kind of highlighted the high-level types of information we want: staff, number of volunteers, training, those things. And so as you all know, we just finished up a reporting season for fiscal year 2016, and we're in process of reviewing your reports now. So what does it do? It gives us, again, at AOA or ACL, we want to get kind of the high-level picture of the Ombudsman program, both the complaints and the issues that residents experience, and just some look at your program in terms of activities, staffing, funds expended. And again, what we need at the federal level is often different than what you need at the state level. I think at the state level, you probably find a lot more opportunity to use the data you collect in NORS and otherwise to promote your program and to promote systems advocacy. And, you know, I think one thing I will say, NORS has been around for over 20 plus years, and it's it's a lot of good, robust data, and researchers look at it, the media looks at it, so it has a lot of value, and we have a lot of history. So how we use it. One big way is to use it for budget justification, and I will show you that table in a minute. We look at what we call outputs and outcomes, and it's not something that you know, we have to show at the federal level in a very high-level way how the funds are used. What's the purpose? What are our goals or our outcomes that we're trying to achieve with the funds that the states receive? So I'll get to that in a minute. We also use it at ACL to inform policy, and I just have an example here of we used a lot of complaint examples that you submitted or systems examples that you submitted in your narratives and the data around discharge eviction to help influence the CMS regulation on discharges and evictions from nursing homes. We also used it to try to support, you know, how can the nursing home regulation better address the care needs that residents, or the lack of care needs that residents experience. And again, that, you know, failure to respond to requests for assistance was the second most frequent nursing facility complaint category, which kind of lends itself to, maybe there's not enough staff there. So, you know, we kind of used the data to help, you know, give a message to CMS about where we thought the regulations could be stronger. With the media, and this is becoming more and more common, that the media is calling us or emailing us to ask us specific questions about NORS data. There's been a lot of attention to nursing home staffing shortages, I think also because of the, you know, the rule-making process that just finished up on the nursing home rule. The New York Times is looking into the issues with eviction. NPR, again, looked at the transfer and eviction issue. Washington Post, they took a more local look at that. So you can see we've had several media outlets that wanted to talk about the NORS data. So you can see how important it is that we are as consistent as possible with our data. So here's an example that we use at ACL to justify the budget, and we have some measures, and they're kind of interesting measures, but again, it's just, you know, we can talk offline further if you want to talk about it more, but basically the thinking is to that over time, if facilities have regular presence, by an ombudsman, a lot of consultation, information, and assistance, that you may see a decrease in complaints because of the proactive nature of ombudsman programs. So that's the theory. So we see a decrease in the average number of complaints per long-term care facility. You know, it is what it is. We also, though, have a measure of a decrease in the number of complaints not resolved to the satisfaction of the resident. And we're not doing hard math here. We are just doing numbers. We're not doing a weighted percent or anything like that. So again, we have for an indicator, output Q is decreasing the number of complaints. Again, it's just a raw number. And we also had an indicator of an increase in consultations. And then we also had a output of regular visits not in response to a complaint. So that's kind of how we currently use the data for budget justification purposes. So I want to just kind of reinforce some of the basic principles of NORS and review for those of you, this may not be new, but for those of you who it is new, just review what is a case, what is a complaint, what is a consultation, what we call the 3 C's. And then I want to kind of walk you through what a case looks like compared to a consultation using kind of the language from the Ombudsman rule. So we'll see how this goes. I've not tried this yet in a presentation. So a case, as you know, is an inquiry brought to or initiated by the Ombudsman program on behalf of a resident or group of residents. It involves one or more complaints, which requires opening a case and includes Ombudsman investigations, strategy to resolve and follow-up. And so the number of cases is equal to the number of complainants. And I've always said, when I trained on this when I was a state ombudsman, that think of the case as the person. It's either one person or it's a group of people, but you have to have a person to have a case. And they have to have one or more problems that they want help resolving. So case is one or more people jointly filing a complaint, and it's one complainant. And a complaint is a concern brought to or initiated by the Ombudsman program for investigation and action on behalf of one or more residents relating to the health, safety, welfare, or rights of a resident. And again, the tip there is one or more complaints constitute a case, and you cannot have a case without a complaint. So there you get into your 3 C's of case and complainant and complaint. So they all go together. The case, complainant are kind of the same thing. They're the person, and they have one or more complaints. A consultation is providing information and assistance to an individual or a facility staff person. It does not involve investigating and working to resolve complaints. If the Ombudsman program refers someone with a concern to another agency and they're not actively involved in investigating and working to resolve the problem, it is not an Ombudsman case or complaint. So kind of like the example that Carol had at the beginning where, you know, you get information or you just refer somebody on, but you're not really taking any action. No one's asked you to take action. It's not a case or a complaint. So I want to kind of walk you through this. When you think of what's in the Ombudsman rule on complaint processing and you think about information and consultation practice, just a few things I want to point out. So when you get a complaint, you know, or the Ombudsman, and I'll just read from what the rule says here, and then I've kind of got more of it summarized. But the Ombudsman or representative of the office shall investigate a complaint, including but not limited to a complaint related to abuse, neglect, or exploitation. And it's for purposes of resolving the complaint to the resident's satisfaction and of protecting the health, welfare, and rights of a resident. So the key thing there is that you are trying to resolve a problem to the resident's satisfaction. With a consultation, you're providing information. You might be sending, telling them to contact another agency. You're not going to find out necessarily if they're satisfied and document their level of satisfaction, right? With a case, going back over to the left-hand side, the ombudsman or representative of the office is going to personally discuss the issue with the resident. On the other hand, with a consultation, you may or may not discuss the issue with the resident depending on who called or who approached you at the facility. When you're working on a complaint, you're going to seek privacy to discuss the issues. Again, with a consultation, privacy may or may not be a factor. If a resident calls from a public phone at a nursing home, there's less privacy. With a complaint, the resident is giving you consent, informed consent to take action. That's a real critical thing there. They are saying, yes, go forward and help me resolve this problem. With a consultation, you're not getting the perspective around consent to take action. You're not trying to figure out what their issues are. You're just, again, giving information. You're not trying to determine the wishes of the resident the way you do when you are working on a complaint. What does the resident want? With a consultation, you're not really seeking that level of, you're not really engaged in that kind of information. They may want information about an agency or a resource. They want information, but they don't tell you necessarily what their wish is with that information. Again, with a complaint, you're going to determine or obtain consent to disclose resident identifying information so that you can more fully work on the complaint. With a consultation, you're not getting informed consent because no further action is needed. However, the conversation cannot be disclosed without consent per the disclosure requirements of the rule. So all of your communications are confidential and subject to the disclosure provisions of the rule. So I guess in theory, if somebody later down the road said, I want you to share the information we talked about, even though it wasn't a complaint, you could share that. But in general, you're not asking for permission to disclose because you have a conversation and it's over and, for that time. With complaint processing, you are, again, advising the resident of their rights. With information and consultation, you might be doing that as well, if that's appropriate. Again, with the complaint processing, you're working with the resident to develop a plan of action for resolution. With information and consultation, you are not developing a plan of action because there is no request for complaint resolution. With a complaint, you are investigating, gathering facts. With information and consultation, you are not. With a complaint, you're trying to figure out, once you get into the resolution and you think the issue is resolved, is the resident satisfied with the resolution? With the information and consultation, there's generally not a follow-up to that one instance. And so you're not really going to ask about, are you satisfied with this phone call or with this conversation? Case notes are documented within a case and a complaint, not as a consultation activity, but just as your case notes. With a consultation, that is documented as an activity, as a consultation with a number of instances and a topic. And just to also clarify that you may offer consultation and information as part of your complaint resolution process, but that is not counted as a consultation activity. And I was glad to see on the polls that were done that that I didn't see people kind of trying to combine case and consultation together, because all of your work related to a case is your case notes in terms of any communications. They're not separate, they're not counted separately as consultations. So I just went through a lot of stuff, and I hope that has prompted some questions that I know you're all muted right now, but we can go back to that if you have questions about that. I wanted to talk about a couple of activities that tend to confuse state ombudsmen when they are submitting their NORS report. The big one is on training. And I know when I was a state ombudsman, I'd have to review this every year to figure out how to report in NORS, because what I did at the state level for my needs did not fulfill the NORS requirement. So I had to go back and do some manual adjustments. So for training, it's the activity is from the perspective of the trainer, and they are reporting on training provided by or arranged by Ombudsman program staff. The number of sessions is unduplicated, and a session is a meeting or a training, whether it lasts for 3 hours, all day, or all week. The number of hours is the time the trainees spend receiving training. It does not capture or include the time spent for preparing for training. So I just did this real simple kind of diagram here. So on the left, you have an example of certification training is offered 1 time a week, and it's 8 hours at a time. So it takes 4 weeks to finish. It's 32 hours. There are 10 trainees. The common error that gets reported in NORS is that they see that 1 time a week as a separate session, when in fact it is 1 session. Well, I'll get to that in a minute. So hold on. So the common errors are 4 sessions. It gets counted as 320 hours and 10 trainees. So the same example on the right, training is 1 time a week, 8 hours at a time, 32 hours, 10 trainees. The actual is 1 session, 32 hours, 10 trainees. So you can see the difference there and see how this gets confused. And I use the example of certification training because that's the most common one where errors are made. So basically, if the training is for what is often called certification training, and the purpose is to designate representatives of the office, and there is a set curriculum and a set number of hours that have to be accomplished to achieve certification training and then designation, it's often, 30 hours, 40, 50, 60 hours. That often gets spread out over time. It may be done at the state level, it may be done at the local level, it may be a combination, but nonetheless, it's still 1 session to achieve that certification training. So that's something that, again, gets confused. When I was a state ombudsman, what was important to me was that training get captured in our data system, in our software. So every volunteer representative of the office, every staff person, anytime they went to a training or a training was provided, I wanted it all in the system. So when it came time to NORS reporting, I'd have to back out a lot of this because things got overcounted. So that may be your experience as well. Facility coverage. There's a lot of confusion about facility coverage. And I guess the one thing I would say is if you have a software system, you just enter all your visits, it should help you at the end of the year to figure out what counts and what doesn't, but you've got to enter it all into your system. So it's an unduplicated count of facilities that are visited no less frequently than quarterly, and it is considered non-complaint, so it's a visit not in response to a complaint, and basically that is our measure for what's considered routine access. So it is not a requirement by the federal government, by ACL, that all programs get out and visit all facilities quarterly. That is not a requirement. It is a way we measure are residents receiving routine access to the Ombudsman program. And the measure is, again, a quarterly visit, so one quarter, at least once a quarter in all 4 quarters of the federal fiscal year, and not in response to a complaint. So, and it's a little frustrating because if you have a dedicated volunteer who visits weekly for 3 quarters of the year and then takes off for Arizona because they're a snowbird, and nobody else gets in to make that visit in that 4th quarter, you're going to lose out on that counting in NORS, and that, you know, that's just the way it is right now. So there's a few questions that have come up. One, and this is in the frequently asked questions. So if a complaint arises during a regular routine visit in a facility, can the representative of the office open a case during that visit and still count the visit as a regular visit to that facility? Yes, it's still a routine visit. You, as say you're a local ombudsman representative, you go out to do your quarterly visits. Part of the purpose is you will be, you will be getting complaints. That's the reason for doing a routine visit, is so that you're accessible to residents, to answer their questions, to take complaints. I've also think though, and I've added to this, that you're not prohibited from counting a visit as a routine visit if you initially made the visit in response to a complaint, if your state has a protocol for what is included in a routine visit. So you visit a certain number of residents, you spend a certain amount of time. I mean, I know there are rural areas, and if your local program has to travel 2 hours to meet with a resident to investigate a complaint, well, while they're out there, it's a great idea to add some more time and do a routine visit. So it isn't like one can't happen with, if you have one, you can't have the other. But you do have to have some guidance for your local programs about what is a routine visit. To stay away from what I call the drive-by visits, where the local representative of the office goes in and says hello to the staff and waves at a few residents and leaves a half hour later. Well, that typically is not going to cut it. So how do you know when your staff make visits if they are in fact engaging with residents? Well, one of the ways you know is, are there consultations? Are there resident council meetings? Are there complaints associated with those visits? I used to think if I saw, say volunteers saying they visited 4 times a month but had no complaints, had no consultations, I would either think they're not documenting or they're not really doing much during their visit. So which one is it? And try to figure that out. So a couple other areas of confusion, and I was probably guilty of this too when I was a state ombudsman. So you have 5 program volunteers who assist with 1 community education event. Is it 5 instances or 1? So basically the answer is, it is 1 instance. You had different people participate, but it's still 1 community education event. So we are not asking how many people attended the event. We want to know how many events did the program participate in. This one is another common one. The state ombudsman and a representative of the office both participate in a survey exit conference. Is it 2 instances or 1? It is, again, it's 1. We want to know how many surveys did the program participate in, not how many people participated, not how many program representatives participated in a survey. So a few reporting tips. Learn the definitions. I think the best way to learn is to get out there and do it. Carve out some time to get out and do some actual visits and to work some cases. It really does help you see the challenges, not only with coding in NORS, but just in resolving complaints. Go through the NORS training 1 through 4, which is on the Ombudsman Resource Center website. And once you've gone through that yourself, work to set up time to review this training with your local program staff and, as appropriate, volunteers, those who are representatives of the office. Expect from your local programs ongoing documentation. I think it's reasonable to expect that data is entered routinely, whether that's on daily, weekly, and that reports are consistently done and reviewed. I think it's really helpful for your consistency if you are building in time every month to either require your programs to report or your staff to report, or that you are, that they are looking at their data and reporting to you as the state ombudsman, or at a minimum that as the state ombudsman you are making sure that reports, that your data is looked at routinely, and I would say monthly is ideal. And if you have access to your technology supports this, I would say do this as you can. If you're out, say, at legislative session and you've got your laptop computer and you can get into your data system when you've got downtime and look at data and just look at cases and just sort of random spot check, if you have time to do that, great. If you don't, but if you have staff who can do that, or even at the local level, you're always going to find people in your program who like data and who like this stuff. So tap into them and see how they can help you. Can they help with training, for instance? So I would say tap into those people in your program who like to do this kind of work on data. I know they're out there. And to borrow an old saying, share from your peers. Your colleagues have lots of good tips and tools, and don't hesitate to reach out and check in with your mentor if you have questions about NORS. There's a lot of good resources out there. A couple other things I want to mention, and this should look familiar. The Ombudsman reporting tool is the mechanism that you use to deliver the NORS report. And a lot of questions come up about, because in the Older Americans Act and in the rule, it talks about reporting to the Assistant Secretary, the way the Assistant Secretary of AOA, and the way you do that is through submitting your NORS report in the Ombudsman reporting tool. As you probably learned, you have to have it installed on your computer, and all the kind of information you need to get that in, to get this reporting tool on your computer is in the AOA data community. The one reason I wanted to include this and remind you of this is because you can run a lot of reports in the Ombudsman reporting tool. It's probably not in some ways as robust as the reports you can get in your own system, but for instance, I'm finding the multi-year complaint trends report to be very helpful to look at how complaints trend over time. And that could be helpful to you at the state level. In the Ombudsman reporting tool, if you go to additional analysis reports, you can do some charts and graphs. They're not the most groovy looking charts and graphs, but they're adequate. So just a couple of reminders there. There again is the link. And again, if you are stuck with anything to do with the Ombudsman reporting tool, your best resource is to email customer support@medaware.com. just, as you probably learned, we do take data quality seriously. You are probably now in the throes of trying to respond to Marianne Follingstad, who's the subcontractor for MetaWare, who does the first review of your NORS data. If you've not heard from her yet, you will. There is a template available, if I have not shared that with you yet, that just sort of highlights what we're looking at when we review the data, what might trigger Marianne to say there's an inconsistency, and then basically once she does her review, then I do a review, and I look at the 2-year compare report for your state, and I look at the multi-year complaint trend report, and I look at Marianne's notes, and I'm just sort of the double check. Sometimes she'll miss something and I'll find it. Sometimes we have both missed something. So, we're human. But we try to, really make sure that we feel confident about what you're submitting, and we know you don't always know why things change in your data, and that is okay. A couple general concerns is that some states have had a pretty significant drop in complaint numbers, and the concern there is that it seems like based on the numbers of facilities and the numbers of beds that they would probably have a little bit more than what they're showing. So that's kind of been a general concern for some states. I would also say more directly at the state ombudsman level, there's a real inconsistent quality of narratives and complaint resolution examples, and we really do use your narrative information. We use the complaint resolution examples in the reports to Congress. We also use examples of some of your systems advocacy work in the reports to Congress, and we have to kind of edit them for that purpose to make, so we don't have that much room in the report to Congress. But the clearer your writing is, and at a minimum to spell check, do a little grammar check. I've said this before, write your narrative in Word and then paste it into the tool so you have a clean version. It just, it helps a lot when you do that. And technically this information is public. So if somebody said, I want to see state XYZ's narratives and NORS, I'd have to give it to them, I think. And if it's full of mistypes and incomplete sentences and whatnot, that reflects on you. So just putting that out there again. So again, further resources, the Ombudsman Resource Center, here's the link for all of the training. And then I have the link to the AGID, the Aging Integrated Database, which is where currently ACL posts the NORS data along with all the other data that ACL collects. Word about AGID, we are trying to phase it out, but that is on hold. So the 2015 data have not been posted in AGID because we were trying to transition to something else. That's not working out very well, so pretty soon that 2015 data will be in AGID. So just in case you went to look for it and couldn't find it, that's why it wasn't there, but it will be there. With that, I am going to...
Louise, thank you so much. And as you transfer the presentation over to Mark, thank you. And I'll mention that the 2015 information is on the NORC website, so you can at least get, you can't maybe do some of the gymnastics that you can do in AGID, but the data and reports are on the website. And if you have not already printed out or saved this entire PowerPoint, it is a handout, and that can be found over in the right-hand side of your in the toolbox for GoToMeeting. And so Thank you, Louise. Our next presenter is Mark Miller, who is the current Ombudsman in Washington, D.C., having come from New York, having come from Virginia. So any of you that are thinking that, you know, one state's not enough, you can talk to Mark about what it feels like to do this in 3 states.
Oh.
So Mark.
Thank you, Carol. Appreciate it. Can you hear me okay? Carol?
Yes. Yes.
Okay,
Yep.
great.
Yep.
Appreciate it. Good afternoon, everybody. Just wanted to take, I have a number of slides to talk with you. And first, I want to say thank you to Louise. It's always good to have some of those reminders, the biggest of which is to look at your data often so that you don't get to the end of the year like I have at points and realized I had 30 trainings but 227,000 hours and then have to go back and try to figure out how to back some of those numbers out. So often it's good to look at your data often. Okay, I wanted to talk with you. Obviously, data is important, but it needs to be meaningful and useful. And I think NASOP, along with Louise and ACL, has done a lot of work in the past few years to look at the data elements and try to make them a little more outcome oriented, which is good. But in order for the data to be meaningful and useful, it has to be complete and accurate and consistent. And all of that is easier said than done. So what I wanted to do is just share a few tips with you to get you started thinking about how to make your data perhaps a little more accurate and how to make your data work for you. So I've come up with a couple of examples and graphics that I'll show you. These are things that I have used over the years with my staff and volunteers. So, but first, there's a few things that we all know for certain, and one is death and taxes, which are coming up for all of us, and eventually a call from Marianne Fallingstad. And as Louise mentioned, some of you may have already gotten your calls. If not, you'll be getting one shortly. As Louise mentioned, Marianne is one of the subcontractors that helps look at the data and certify it. And she is looking for variances year over year. And when you, for most everybody, I think we've submitted our annual reports for 2016. You'll notice when you go into ORT that you have some options to run various reports, one of which is a 2-year comparison. And if you haven't used that, I would encourage you to go ahead and run that report. It will show you where your significant variances are in all the data points year over year. And that's one of the things that Marianne obviously is going to be paying attention to and asking you about. So if you do that ahead of time and you look at those numbers and you see where the big variances are and try to figure out why, that just kind of gives you a head start, I think. So, and generally, Louise, you can correct me if I'm wrong, but I think anything that's more than a 5% variance, you kind of like an explanation for, I think.
Yeah, 10%.
10%. Well, that makes me feel a little better. Okay. All righty. So as we mentioned, and as Louise described, recording the work is very important. The data tells the story about what your program does and the impact it has on residents. And I think data demonstrates not only where you've been, but kind of informs you as to where you need to go. And so as you can see from the graphic, there's case information, there's the 12 program activities such as information and consultation and training and work with family and resident councils, those sorts of things. And then also valuable program information, which is more how many facilities do you have, what's your budget like, how much staff do you have, and all that. So all of that information is funneled in and goes into your NORS report. And it's very important. So I use this actually with some of the volunteers. It's just it's not a great graphic, but it's obviously Woodward and Bernstein saying, you know, do you think it's going to matter if we submit this story on Watergate? Well, obviously it does. Our data does matter. There's 2 big challenges that I think most state ombudsmen face in getting their data accurate and consistent. One is actually getting volunteers or local staff to report their work. and this obviously, as Drew said, been done as well. Volunteers often like to go into facilities. They like the idea of helping people. They like the idea of helping resolve issues, but they're not always so good at recording it and reporting it. And we'll get to how to help with that in another slide or two. And the other, I think, is just ensuring the consistency and quality of the data that is reported, making sure, and Louise's slides and some of those exercises I think are good to use repeatedly with both staff and volunteers to make sure we're all counting things the same, that we see, you know, what's should be put in. For instance, media is the same, what counts as a consultation, everybody's kind of on the same page with that. So it's really important to kind of continue to do those exercises, and these are ongoing, I think, ongoing tasks for any ombudsman program. So how do we do this? Well, tip number one is share the data. Don't keep it to yourself. Give the data back to the local programs. Give them the facts so that they can see the importance of the work that they're doing. Tell them where the data goes. Surprisingly, when I have talked with volunteers particularly, they think it just gets put into some little system at the local level, and there it stays, and so they don't immediately see the value of it. And don't assume that they already know this. I should probably have inverted this, where the volunteers are obviously the bigger piece of the pyramid, but I think it's helpful to describe to them the levels it goes through, and that ultimately, you know, it's going to the feds, it's going to ACL, they're compiling it and giving it to Congress, so that, you know, there are representatives that see the great work that they do, and I think that hopefully inspires some of the staff and certainly the volunteers to do that. The other thing is show them how the data is used, how it's reported, and what you're doing with it. Obviously, for accountability purposes, to show our offices what we're doing. For funding purposes, it's very important. For program management, that it helps us develop training, helps us set program priorities. General information sharing, both with the public, with regulators, with policymakers, that our information makes a difference to those entities, and certainly, as we'll see later on, can impact systems work. Identifying, tracking, and analyzing trends, particularly with emphasis on complaints, sort of issues that we're seeing that we can again share with the public and with policymakers. And then the bigger issue of using our data to support larger changes in the long-term care system for the benefit of residents. And then try to show them the difference that it actually makes. Now, these are 2015 numbers nationally, and again, I don't assume that volunteers or even your local staff are going to know this. You really need to put this information together and share it with them so that they can see how they're adding into the overall national statistics of the program. You know, and these are pretty impressive. I think these are pretty impressive numbers. You know, 400, you know, individual consultations to folks, almost 200,000 complaints investigated, and the fact that we've resolved more than 72% of those complaints. Those are big, and those are big numbers. They're very impressive. Tip number 2 is create a healthy competition. Ombudsmen like to know how their data compares to other programs, both within your state and then also the bigger picture nationally. And so there's some ways to do that. And I have found, working in other states, we don't have local programs here in the district, but in the other states where I've worked, I have found there's great interest between programs knowing, well, how many information and consultations did you, how many complaints did you handle? And so I think there's some creative things you can do there to incentivize some healthy competition. So what are some of the what's some of the information that I give them to do this? Well, as you can see, here's complaint venue. It kind of shows where your time is going. Now, we're a little skewed in the district. If you look at the national side on the right, in the past it's always been about a 80-20 split between nursing homes and other adult care types facilities. I think as assisted living has grown, obviously you can see now it's more of almost a 70-30 split with a very small percentage of other, and other may be home and community-based services. And there are, I think, I don't know, Louise, you can correct me, but I think there's 12 or 13 states now that have some responsibility for responding to home and community-based service complaints.
Yeah, I think we're at 13.
13, yeah. In the district, we respond to Medicaid waiver complaints for people that are receiving services in their home. And so you'll see that in the district, and I would have expected much more of the 70-30 split, but in reality, when I looked at our numbers, clearly we're putting a lot of time and resources into that other category, which is the waiver complaints. And so that kind of tells you from a program management point where your time is, where your staff's time is being spent, and then you can redirect training and resources as appropriate. But that's just one of the sort of graphics that I will use to show people here's where our work is happening. The other, and this is pretty big, and you can substitute where you see national, you can substitute state, and then go by region to show, well, where are we in facilities on a regular basis, and what sort of access to residents have. And I have found this was one of the most competitive data elements amongst local ombudsman programs, particularly in New York when I was there. It's really like, well, we're striving to be in every facility as much as we can. So here you just see, and these are DC and national figures from 2015. We only have 18 nursing homes in the district, so it's pretty easy to get to all of them once a quarter. Not so much with our adult care facilities, our smaller group homes. It's a little bit harder. But again, it gives, I think, people a graphic, and you can substitute out region or local program for local, and then use your statewide numbers as well. This, I think, is helpful as well. Show them the types of complaints that you're getting by region as compared to the the compilation at the state level. Here you see the breakdown from the district and nationwide in 2015, and you can see it lines up pretty well. There's a few variations, but I would use this sort of information to engage staff and volunteers in a discussion of why did the numbers look like this. So you can see the numbers, but you don't necessarily know, well, why, for instance, is medications so high in the district, or why is billing and charges on kind of high on our list, and it doesn't even show up nationwide. So as the state ombudsman, you're not always going to know the why. You're going to need them to engage with the numbers, and again, I think that that helps. You can identify trends and use that in training, but it will also tell you, are we documenting things correctly? With discharge and eviction, I can tell you, as I've looked through some of the complaints and had some discussion with my staff, that number, I think, is a little bit higher than it would normally be, because I think we've categorized things as discharge and eviction that could have been categorized as something else. But those are the numbers as they are right now. And I think it's good to look at where the program is relative to national data and trends, and ask some of these questions. So this again is from 2015, and it shows nursing home complaints, and broken down by major category. I don't think they don't change much. There's been a slight dip in them, but you might want to ask, well, why is there a difference? Is it real? How are we recording our work? And as an example, so here you have complaint versus consultations, and I think Louise's presentation was so helpful. You really need to continue to work with staff on, are you recording things accurately? So as you can see here, it's about a 2-to-1 difference between consultations versus complaints. When I looked at this information myself for the district this past year, it was the flip of that. We had twice as many complaints as we had consultations. So I had to ask why, and we started to have to look at some of our data. And what we really found out was that some of the things we were counting as complaints were really just consultations. And so we've done some additional training, and we're getting that back on track. But those are the sorts of things you want to show your staff, to share information with, and then use that as kind of a springboard to asking, why do the numbers look like that, and why are they different from what another local program's numbers look like, or why are they different from what the national numbers look like. So tip number 3 is use your NORS data for program management and quality control. I've used bi-monthly data calls with local programs in the past to just sit and talk, have open discussion. Maybe we would focus on a particular type of data element, like consultations and all of that. But I think it's important to continue the discussion around data and around consistency and how things are being captured and are things being captured. That's an ongoing discussion. To look at also do some individual case reviews on perhaps a quarterly basis with your local or regional programs, to just look at exactly what it is they're capturing in the complaints. Is the data there? Is it complete? Would you be afraid to share it with somebody if it was subpoenaed? That sort of thing. And then also using the data, I think, kind of data-driven annual work plans and local program assessments, to use the data in that way. So, and obviously you can see some things there. You're informing the public, you're directing your program, hopefully motivating your staff. Ultimately, you're telling your story and you're using your data to make a difference. And lastly, tip 4 is, and Louise obviously spent some time on this, and I think it's important to say again, is don't reinvent the wheel. There are a lot of resources out there to help you with your data and to help ensure your data is accurate and consistent. Use the training tools that are available on the websites at the Ombudsman Resource Center. I would continue to use those training modules. They're very good. They have examples that are continually updated that I think are very, very helpful. Talk to your colleagues, as Louise mentioned. Share from each other is a big thing, and talk about your data. And if you're not sure about how to record something or why your numbers might look the way they do, talk to your colleagues, talk to Louise, raise the issue. And I think these are still accurate. Louise, I don't know, I know you're talking about the aged is possibly going to go away. I don't know if that's still the current. It's the one I've been using, but I don't know if that's the current website.
It should be. It just doesn't have the 2014 or 2015 data in it yet, but it hopefully will soon. Okay. So yeah, those both should be okay.
Perfect. So that's everything I had to say, and I want to make sure we leave enough time for questions that people have. So Carol, do I need to?
If you could make me the presenter, that would just be awesome.
Right.
I want to thank you, Mark. You've raised a lot of good
problems.
Yeah, a lot of good ideas. I'm thinking of the issue of, what's a good process for monitoring your local programs, and it seems to me that you laid out a perfect scenario of maybe doing some training on a particular area, watching that, and then as you're visiting within a particular local entity's office, is being able to pull out those documents and show comparisons and be able to not really quiz people, but to just ask, and have a good conversation about, why do you think that your numbers are, bigger or smaller than they were in the past, or different from everyone else in the, in the state or whatever. So I think you've hopefully given people some things to think about. What we're going to do now, and I will remind you that if you wanted to write a question in, you can use the question box on the right-hand side, open up your GoToMeeting toolbox. We'll also be opening the lines here in about 4 or 5 minutes, and so we'll be able to have some time for some questions and answers until the bottom of the hour. In the meantime, I want to just do one more quick case, and this is a nursing home resident who complains that the facility is keeping her money. They're ripping me off. You, as the ombudsman, go to the business office manager who and ask, say so-and-so has given me permission to ask, if there's an accounting of her money, and the business office manager tells you that the resident is paying for her phone in her room, and that's where a lot of her money from her personal needs and allowances is going. And she uses the balance to have her hair done and purchase some personal items. You report back to the resident, and she's, oh my gosh, I didn't remember that I was paying for the phone. She's glad you straightened it out. She really does like having the phone to keep in touch. So Katie, if you'll open up the next poll. And so this is asking whether or not the complaint is verified. And Katie, I'm hoping that enough people have voted. If you want to close, and Louise, if you could tell us what you're seeing.
Okay, 43% said yes, it's verified. 57% said no, it is not verified.
Okay, we'll come back to that. Then if you'll open up the next poll. And this poll is asking about whether or not, or what the disposition is. In other words, at the end of every complaint, you have to put in where the, what happened. So whether it was not resolved to the satisfaction, whether it was withdrawn, whether no action was needed, whether it was partially resolved, and whether it was resolved to satisfaction. And those of you who may have spent some time looking at these dispositions may recognize that referral to another agency or organization is not listed here, and it's only not listed here because I only had 5 choices of answers, and I didn't want to put 2 choices on the same line, and so I took away your option of choosing referral. So, Katie, close this up, and Louise, tell us what is being said now.
We have 88% who say it's resolved to the satisfaction of the resident, and 13% say no action needed, and the rest are zeros.
Okay, thank you. Okay, so close that up, and I should be back on the air. Cool. Can you all see my screen now?
Yep.
Excellent. Okay. So verifying complaints. We always want to attempt to verify complaints, but sometimes it's just, it's really hard, but we still have to work to resolve a complaint, whether or not you can verify it. And the definition of verified is it's determined after work. So interviews, record inspections, observation. In this case, we went to the business manager. So it's determined that the circumstances described in the complaint are generally accurate. So she said, my money's being stolen. That was the complaint. You went to the business manager, she explained, no, we're not, ripping her off, although you wouldn't have probably said that to her. But in fact, here's where the money's going. So in fact, the answer is no, it is not verified. And I remember that was just only, 57 to 43%. So this might be something people want to take some time looking at and kind of maybe looking at some of the examples in the NORS training to understand when something is verified or not. So it's verified when the circumstances described in the complaint are generally accurate. So it's not a negative thing if we show unverified. When I was a state ombudsman, I always wanted to say, hey, it's verified, because that means we did something. But the verification is not whether we did something or not, it's were the circumstances described generally accurate. So the answer is no, it's not verified. The disposition, this is a case of it didn't matter whether the complaint was verified. You still had to do something, and actually we didn't know it wasn't verified until after we did something. So we discovered that the facility is not keeping the money. They're paying for the phone. The problem was resolved to the satisfaction of the resident. So in this case, it would be resolved to the satisfaction of the resident, because even though it wasn't what she wanted to know, how come I don't have more money? You answered her question. You went back to her. She said, oh, okay, I forgot, but I want to keep my phone. So she, in effect, is satisfied with it, and that is the outcome of this. Those were the things. So we're going to, so Katie, at this point, boy, we'll see how scrambled this gets. I guess we'll try opening up all the lines and see if people have questions. If that gets too noisy, we may end up having to ask you to use your toolbox to open up, to raise hands.
Okay, I'm unmuting everyone now. Everyone should be unmuted.
Okay, sorry about that. I somehow lost my ability to talk. So everybody should be unmuted. And so if anyone has any questions, feel free to speak out.
Hello, Matt.
Yes, Victor.
Yeah, this is Victor. Yes, a question for you. In your data, I think complaints of visitation, you indicated about others. What would that mean? Would that be home community? Or, I know you listed the nursing homes, you listed adult care homes, and then you listed others. I think about 20-something%. Would that be home community, or what would that mean?
Yeah, Victor, this is Mark. Those are waiver clients that are receiving services in their home.
Okay. Okay. All right, good. Thank you.
They could also be, in other states, they could be smaller homes that maybe are not considered assisted living, but are other kind of personal, care homes or something, right?
Well, those would count as board and care, but it could be, say, managed care services for people who are not in long-term care facilities.
Okay.
Yeah, it's generally something like that, or some other kind of ombudsman service that's not in a typical board and care or nursing facility. Yeah.
All right. Okay. Thank you.
Thanks. Other questions? If you are trying to talk and we're not hearing you, feel free to raise your hand and we'll try, but everyone should be, you may need to go up and unmute yourself. Even though Katie has unmuted you, there's a little microphone. If it's gray, that means you've been muted, and you can click on it and you will unmute yourself then.
One thing I'll mention just while people are thinking about questions is I have seen occasionally some people get confused about that definition of verified, and they think, well, I investigated it, therefore because I investigated it, I verified it. And so just a reminder that verifying is, again, about the facts and is the circumstances described in the complaint, is that generally accurate? Not verified, yes, we investigated and therefore we verified. So that's been something that's confused people off and on over the years.
Great, thank you. Other questions, comments?
Carol, this is Mark. I just wanted to make one clarification.
Sure.
Obviously, when you're trying to share information with local programs, as the state ombudsman, you're going to be the only one. If you're using Ombuds Manager, for instance, you're going to be the only ones that can produce those statewide numbers. Local programs won't be able to run that sort of report, and certainly they don't have access to ORT. So they're going to be dependent upon you to run those. But I would ask them to run their own Ombuds Manager reports, one, so they know how to do it, and two, they can, it kind of just helps the process, I think.
Okay.
Yeah,
and
I would just reinforce that if you have a requirement that at some routine time frame that your local programs and whatever system you use, that they run some basic reports and get used to looking at their data and explaining their data, it really goes a long way, I think, to help with your consistency and also to see the value. The more you use it, the more valuable your data can become.
Absolutely. What you're seeing on my screen right now is I went to the National Ombudsman Resource Center website. I clicked on support. I clicked on training, and I come up with all these different trainings, and here is the NORS training material and data. And as you will see, there are instructions, there's the complaint codes, there are modules for each of the various parts of NORS. You can go through, and as I think both Louise and Mark said, go through this training yourself and then use this as part of your ongoing training for your locals. There are webinars, this webinar will get added to this page, and you will see that there's here's where the 2015 NORS data is, each of the different complaint tables, and again, this was in the Resource Center. Click support, click training. Now, you can go to the login side. There it is. You can go to the login side. You're going to go down here to State Ombudsman Support. You're going to come to NORS training, and here it is again. So you can get to it from both places, whether you're in the logged inside or not. So with that, we are coming to the end. I'll ask one more time if anyone has any questions.
And always take an email question later, or a question, certainly the Resource Center as well, or Mark, or any of us. So.
Absolutely. Well, I want to thank Louise Ryan with ACL and Mark Miller with the DC Ombudsman Program for assisting NORC with this webinar. We intend that this information be helpful to new state ombudsmen and also helpful to those of you who've been around for a while. We look forward to seeing everyone at the in-person orientation in a couple months. We hold ourselves out to be of assistance to you if you're looking at information or help with your NORS. So thank you again for attending. You will be receiving a Survey Monkey, and we appreciate your response to that. Thank you, everyone, and everyone have a great rest of the day.
Thank you.
Thank you, everybody.
Thank you, everybody. Thank you, Louise.
Bye.
Bye-bye.
Bye.